to Health Talk. With me today is Kim Dawkins, the Executive Director of Pathways for Change. Pathways for Change is formerly known as the Rape Crisis Center for Central Massachusetts. And I'd like to welcome you, Kim.
Thank you for
coming today. Pathways for Change is about sexual violence, which is a leading public health problem. And can I ask you to describe what sexual violence is to the audience? That'd be great.
I would love to, and I really appreciate the opportunity. Thank you for inviting me onto this show. This is kind of exciting to be able to talk about something that you're passionate about. And sexual violence is something obviously that impacts all of us, regardless of gender or age or race, and whether or not we're specifically individually impacted, we're very often impacted by someone close to us. So sexual violence is sort of the umbrella term that covers a lot of other issues like rape, sexual harassment, dating violence, stalking. I mean, there's a whole number of issues that fall under sexual violence. Violence, as we know, has become such a part of the culture that we live in, sadly, and we've become so desensitized to violence that it makes it very difficult in dealing with a subject like this. And I think also because, for the most part, we have, for generations, really talked about sexual violence in reference to rape. And rape is still a taboo word. It's still a very hard word for people to say. It's a very hard word for a community to acknowledge is happening. And it's becomes so difficult to talk about that it's one of those subjects and issues that tends to be pushed aside. Because it is tough and it is hard to talk about. But that makes it all the more important reason to be able to talk about it.
Oh, exactly. And with rape and with all the sexual violence comes physical health problems and mental health problems.
Absolutely. Any kind of sexual violence has a lifelong impact to the survivor. The way I can most easily try to think of an analogy would be that all of us actually in our lives experience trauma in some form or another. How the trauma impacts each one of us might be felt differently. An example of that would be a car accident, for example. If we haven't personally experienced a car accident, we certainly know someone close to us that has experienced a car accident. And what very often happens in those kinds of situations is, whether it's a minor or a major accident, there are often initial impact of the accident. There could be some physical injuries, there could be certainly some emotional response, some internal injuries. So there's a physical, a psychological, and emotional effect of that accident. We tend to rally around the individual, obviously, and have family and support networks when something like that occurs, because it is a horrific occasion, occurrence, and it's something that we want to be there to support the individual through the healing process. That's something that as a community we can sort of easily, readily accept. Well, in a similar way, when any individual has been impacted by sexual violence, there is the trauma, the immediate trauma of the incident, which is horrific enough in itself. And the aftermath of that incident, that individual then, very often, there are several different kinds of responses to that trauma. If they are fortunate enough to have a circle around them of family or friends that, number one, will believe them, that, number one, will come forward to help or support them or help them get support, that can be make a tremendous difference on the person's ability to be able to go through that healing process and be able to sort of find some joy in their life again at some point. But that healing journey is also going to be very different for every individual. And that largely not only depends on the individual themselves, but the circumstances around the incident and whether or not there's also been some prior trauma. This may not be the first time that this has occurred. And I think one of the things that we do at Pathways is really, when we're working with a community, is talking about some of the myths that we work so hard to dispel. One of those first myths, such is one that is victim blaming, is very, very common. It's much easier to say, she shouldn't have been wearing those clothes, she shouldn't have gone out drinking, why did she go, back with him to his apartment? It's much easier to sort of put the blame on the victim than to really, say, wait a minute, let's really start talking about who the perpetrator is and why this was perpetrated in the first place. And so the issue itself of sexual violence becomes so large, and we really have to actually start having the conversation about what are the root causes of sexual violence, and we have to start looking at our societal attitudes and culture in order to do that.
Well, and culture is a huge factor. A huge factor. There's a lot of justified abuse in certain cultures, and they bring it here to America as well, and where it's not justified.
Right.
Now, Pathways for Change, offers many programs I was really impressed with, not only for the victim, but for the families and friends of the victim, which it didn't surprise me, but I kind of look at being a victim as, solitude or wanting to keep it to themselves, and the friends and family almost feeling lost. How would I go about, helping? So I thought this was wonderful. One of the groups, face-to-face peer counseling, what happens in that type of counseling?
Yeah, I'd be happy to talk about it, but I want to back up a minute because you said something very valuable just now when you talked about how we can also service beyond just the individual survivor. And we use the term survivor, by the way. Any kind of sexual violence, certainly rape, is a crime. And so if you have been in the unfortunate circumstances to actually have experienced rape, you are a victim of a crime. The reason we tend to favor the word survivor really comes from our survivors themselves, who we work with, who's saying, I prefer to define myself as a survivor of something terrible and horrific rather than a victim. Now, that's not true for everyone. There are some people that say, no, I am a victim, it was a crime, and that's how I see it, and we respect that. But so I just wanted our viewers to know that we use the term victim and survivor interchangeably, so they understand why we do that.
Sure.
But you made that point about the family, and I think that is also critical because so often, as you mentioned, we can be close to someone who's experienced an incident of that nature. And very often the question is, what can I do? What can I do to help this individual? How do I help this individual? And also remember that there's an impact, there's a secondary trauma that occurs when it is someone close to us that we love and care about that has experienced that. So it becomes even more critical that we also get some support. So it really is important for the community to know that if you or anyone you know has been a victim of any kind of sexual violence, that not only can we help the survivor, but we can help their significant others, whether it's a partner or a family or a friend, because that support is just as important. You need to be able to understand sort of what's happened and very also understand some of the ways that we cope with that kind of trauma. And very often, some of the biggest barriers, for example, to being able to even come forward for a survivor is the fear of not being believed. That's a big one. So if nothing else sort of from this conversation that we're having today, I hope that our viewers take away three things. One is if anyone ever comes to them and shares this kind of a story, because it takes a huge amount of courage to share your story, believe them. Start by believing. That would be critical. The next one is to also let them know they are not alone. And the most important one, I think, is it's not their fault. That, I think, is huge. There's such a lot of self-blame that happens for survivors. And shame. And so there's so many fears in being able to even come forward that if anyone discloses to you, whether it is a family member or a friend, it is such a tiny, 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 less than sort of, 1% that will actually falsify a report, that will actually lie about something happening to them. So really, that first step is critical to start by believing. That's their first step to healing. So we actually, each one of us, we don't have to be a counselor to be able to actually make a difference for someone. We need to be a good listener, and we need to be able to at least show some empathy and support by believing and telling them it's not your fault. And that's a huge piece.
Yeah, I think
so that helps someone start on their healing journey. And then the family and significant others can gain support. And I think the other thing that's important for us to recognize and acknowledge is Sexual violence doesn't discriminate either. It's for a long time been thought of as a women's issue, that rape only happens to women. We are seeing much higher numbers of men reporting and transgender individuals. And we have to acknowledge that and talk about that, because for anyone there is no excuse, in other words, or no reason to give permission to somebody to assault you. There is nothing that you could have done or said or worn. I don't care if you've been at a party, I don't care if you've been drinking, none of that gives someone permission to assault you. So it really is sort of across the board, sexual violence does not discriminate. But it is a huge problem in our communities.
Very good.
And sadly, some of the highest risks of individuals being assaulted are from the ages of 14 to 24. So we see it a lot in high school and in college. Now that it happens at all ages,
Right.
but we see higher numbers within the teenage to young adult span. We see higher numbers. And I think you have to remember that nationally, every 2 minutes, a woman is sexually assaulted.
Every 2 minutes.
Every 2 minutes. Now, when you think about that nationally, that's a pretty staggering number. And in lieu of that, I think that it really should become something that we as a community say, this matters to us. Sexual abuse of children, sexual molestation of children. I think it's what we call the silent epidemic, quite frankly, because it is still an issue that is not talked about, but is rampant within our communities. And we have a rape culture, basically, that we've sort of accepted. One of the ways that manifests itself, not surprisingly to you, will be how when we talk about oppression, when we talk about racism, when we talk about poverty, when we talk about homelessness, all of these can be contributory factors. But most importantly, it really comes from a lot of the oppression that happens in our society. And until we start addressing those issues, because those truly are the root causes, we're not going to be able to prevent it. And a big piece of what we do is about prevention. So
education
that's
and
what
outreach
you were
efforts.
talking about earlier, is that in order for us to think and imagine a world without violence, right? We would all love to see a world without violence, but in order for that to actually occur, and it is possible, we really need to start talking now and providing education now to individuals as young as we possibly can get in front of them.
To make it, and these educational outreach efforts is basically making it not acceptable in society anymore.
Yeah, and it's all done in very age-appropriate ways. You know, you're going to talk about, you're not going to go in and talk to a bunch of middle schoolers about rape. You are going to start talking to them about bullying. You are going to talk to them about inappropriate touching. You are going to talk to them about, you know, the kinds of situations, so that children at younger ages can actually have some tools themselves that they can start to actually sort of become a natural part of their behavior, to know that, oh, so it's, you know, a little bell will go off there, and it's not okay for my uncle to touch me, you know, in my, you know, private areas. And I think that's also one of the biggest myths that we tend to forget about in this work, is that more often than not, sexual violence is perpetrated by somebody known to the victim. We tend to think of it as the monster jumping out of the bushes in the dark parking lot. Now, those incidences do occur, they do happen, certainly, but it is much more often closer to home. It is somebody that has some level of trust with the individual, and certainly familiarity with the person. It can be a landlord, it can be a roommate, it can be a father, an uncle, a grandfather, it can be a sister, it can be a friend. I mean, the list goes on.
And because of that, that's where the fear of not being believed.
Absolutely.
They come forward.
Well, imagine it yourself. If you are the victim of something as horrific as that, and it is somebody known to you that you have had some trust with, there often can be extremely conflicted feelings and emotions there. This is someone who you've trusted, someone who you perhaps even love, because if it's a close family member, the trauma of that is just enlarged sort of exponentially. So it is hard to imagine, isn't it? And so sometimes we talk about this with our volunteers and even survivors, because we want to be very much survivor focused and survivor led. And we ask those tough questions, how do we continue to do this work, number one, without being discouraged, without losing hope? I often get the question, Kim, why are we still talking about this? Why hasn't this just disappeared by now? Why are we still doing this work 30, 40, 50 years later? And there are two answers to that. One is, sadly, we haven't evolved enough as human beings yet to really embrace the idea of treating one another with the utmost of respect, regardless of who we're interacting with. And I think the second part of that is also that until, again, we start thinking about how we raise our children as adults, as parents, and the messages that we are giving to them, somebody doesn't suddenly become a perpetrator. There is a series of events and a series of ways in which we influence an individual as they're growing up to accept or reject certain behaviors. An easy analogy of that would be something, this will make a lot of people laugh, picking your nose, right? Now, everybody does it at one time or another. We don't like to admit it. Kids will be the first ones to laugh about it, but that has become in our society something that we all sort of generally acknowledge as unacceptable in public. If you're going to do that, you do it in the privacy of your own home or your own bathroom, but everybody does it. So when you're driving along the car, and you look over and you see that person picking their nose and you chuckle to yourself, because you say, okay, they don't know that I can see them right now. But there's sort of that blanket social acceptance that, okay, and it's what we teach our kids, don't pick your nose in public, and they think it's funny, but we have, as a group, sort of universally said that's not okay. Why haven't we applied that same social attitude toward violence? Why haven't we, as a community and a society, said that's unacceptable? You will not speak to somebody like that. You will not physically posture like that. You will not physically attack somebody. That is unacceptable behavior. When are we as a community going to say zero tolerance for that kind of behavior?
At what point does the perpetrator start showing signs? So you mentioned bullying earlier. Is that kind of what am I trying to say? Just like a beginning stages?
Well, it can be. And it doesn't, obviously, not every child that's a bully is going to grow up and be a rapist, certainly. But there certainly are warning signs that we should be paying attention to. And I will also say I don't blame the child. Because if you think about it, children learn by the adults around them. So a child who is in a violent life, or in a violent home, or a very unstable home, what they are learning is what's being modeled around them. So we as a community, and also within our schools and our families and our neighborhoods, need to model the behavior that we wish to see. And that won't happen until we can, again, universally accept what are the appropriate models of behavior. One of the examples, another example that I can think of is to sort of highlight the difference of how we think about victims of sexual violence as opposed to victims of other crime. A man goes to an ATM machine at 11 o'clock at night. He's very well dressed, got an expensive suit on, you can tell, expensive shoes, expensive watch, gets out $300 in cash, and is accosted by a thief who's been watching him, who followed him to the ATM, holds him up at gunpoint. Now, that scenario, if I asked, and I do this often in a room full of people, who do we blame in that scenario?
Well, we blame the gentleman all dressed up in expensive clothes and being at the ATM, or are we going to blame the...
We normally right away say, oh my God, the poor man, right? Catch the thief, right? So that is actually the more natural response, because we sort of societally accept that it's not okay to go and steal from somebody, right? No matter how they're dressed.
I was thinking more, but blame it on...
And you're right, Kathleen, you actually picked up on the analogy of that same scenario, if you think about it, we don't turn and say, well, he shouldn't have been there late at night. Well, he shouldn't have got out that much cash. Well, why was he flaunting his money by wearing such an expensive suit?
Yeah.
Why did he go to the ATM in that neighborhood? Okay? We typically do not do that in that scenario, but it's the first place as a community we go when it is someone who has been raped or sexually assaulted. That we automatically tend to come up with this attitude of somehow they should have protected themselves. And that's where we have to have sort of a paradigm shift in our thinking. And that, again, comes full circle to having conversations about societal attitudes. And it's why the work we do at Pathways, we are about social change. You know, people often say to me, well, you see survivors of rape, right? You're all sitting in cubicles with red phones because you have a hotline, you know, and you're just dealing with women who've just been raped. Because that's the image that is sort of out there still. And no, we don't have red phones, we don't sit in cubicles, you know. Yes, we have individuals in extreme crisis calling our hotline 24/7 that need immediate support, and we will always do that. Yes, we provide individual counseling. Yes, we provide education to the schools. So we will always be there for survivors. And we will always be there to provide education. But the bigger picture is really about trying to change society's attitudes about what is acceptable behavior when it comes to violence. And when you think about how objectification of women in the media and music and video games and advertising, when you think about the acceptance of violence in video games that children play, when you think about how we talk about in jokes, you know, in mixed company and use words and phrases that we think are funny, that really aren't that funny, it really is about changing how we see the world. It's the lens through which we see the world around us and how we interact with one another that's going to ultimately make the difference. That's not going to happen overnight. No. I'm not about to say that, oh yes, if we all just, you know, treated one another wonderfully, it'll stop tomorrow. Because change is slow, and it is a process. Just as a survivor's healing can take a lifetime, certainly to think about embracing a culture of peace and nonviolence is going to take a lifetime. And, you know, the changes probably won't be in our lifetime. But I would like to think and believe that collectively, and this is why it's so important when we come together as a community. Webster's doing some wonderful things. And I think when a community comes together and says, you know what, we do care about this, it does impact me, it does impact us, and it is enough, and I feel strongly about it that we need to come together on this. And men and women and transgender, all of us need to come together on this because it doesn't just impact one group of people.
No.
We really have to come together on this.
Yeah.
So it's an ongoing challenge, and the positive side is always when I see aha moments, when we're in the schools and the kids get it, when they start to recognize, wow, when he's texting me 20,000 times a day demanding where I am, maybe that's not because he loves me.
Right. Now, so you said in the schools, is that part of the sexual assault youth education program?
Yeah,
you actually go into the schools?
We do. We actually go into the schools, and we have a actual evidence-based curriculum program called Safe Dates. It's empirically based, and we use that program. We adapt it according to the various schools and the population that we're with, obviously, and the unique issues and problems that the kids are facing.
Right.
And we meet the kids where we're at, and it's very interactive. And the kids are smart, and they don't hesitate to share with you what's really happening. And it's not someone my age going into the classroom.
And a lot is happening. You mentioned texting. I mean, now there's something called sexting.
Yeah.
You know, pictures, of naked girls or being sent to boys. I mean, this just seems to be on the uprise and happening very often.
It is.
And
well, in the
worrisome.
age, it is worrisome, but the age of technology, and that also speaks to how we can't just sit back and ignore how kids are interacting with the world around them and their means of communication. So we have to catch up. We have to get up to speed. Technology is advancing, whether we like it or not.
Right.
It's advancing with or without us. So a lot of the work that we do is focused on how are young adults and teens communicating with one another? We're not living in an age anymore where teens are as often on the phone for 45
Right.
minutes with their friend. They're texting back and forth constantly, and with multiple friends, multiple texts going on a lot of the time. So the cyberbullying and the cyber stalking and the sexting, that you're talking about, absolutely has become a real problem. And it is still part of sexual violence.
It is.
You are still subjecting an individual. And remember that when we talk about sexual violence and any of the specific things that fall under sexual violence, it really is about power and control.
Exactly.
The individual perpetrating the violence, it really is about stripping the victim of any power and control that they have. And that is one of the reasons why in the work that we do, we call ourselves sort of the community mobilizing organization, but it's also about empowerment. And the empowerment really is about how do we help survivors regain some of their own power and control back. And you can imagine, if you've had that stripped from you, that's one of the most difficult things to get back.
It is, and all of these programs at Pathways for Change are free,
They are.
and family, friends, spouses are all
They can all-
invited. And I was reading some of the testimonies from some of the survivors that were wonderful. This agency has saved my life. My counselor is awesome. Coming here has made me to be able to cope with years of anger and frustration. I now have the strength and courage to overcome the abuse in my life. I mean, that's just wonderful.
It's
Wonderful
huge.
testimonies. I mean, it's the horrors that they had to go through.
Yeah, you're
Yes.
absolutely right.
But, to have an agency that's so wonderful and free.
Well, and I think and thank you for mentioning that, Kathleen. That's really important, not only that folks know that the services are free 24/7, 365 days a year,
365 days.
but that it's also confidential. I think that's one of the biggest things. Many survivors reach out to us, especially on the hotline. There is such a wonderful level of anonymity provided to them. They do not have to disclose their real name if they don't. We don't ask for identifying information, but even when they call, they don't have to use their first real, their real first name. They can actually say, if I were calling, for example, instead of using my real name, Kim, I could say, this is Sally calling,
And I need help.
So, and this is my experience, or this is what I need to talk about. And we also, with the hotline, encourage folks to only share what they're comfortable sharing.
Right.
We're there to provide them with that crisis support counseling. And that can be at any time of day or night. And so very often, survivors are understandably afraid, anxious, very often in crisis. Sometimes it can be immediately following an incident. Sometimes it's an adult survivor of childhood sexual
Yeah,
abuse
I read that.
who is only now able to have a voice to what happened to them many years ago. For some of them, it's also only come to the surface of their memory in recent years. And something may have triggered that, or there may have been flashbacks. It's not uncommon.
No.
And so, again, it's sort of a way that we try to let the community know that there are so many different reasons for needing support and ways that they can get support through us. And just to know that it's confidential, we do not share that information with anyone. We don't report any demographic of identifying information to anybody. There's no insurance required because the services are free, so there's no way to trace that back. So there really is that sense
Level
of
comfort.
like, oh, okay, I can talk about this and I don't have to have anybody know. Because very often survivors are not ready to share their story with the world.
No.
Sometimes they don't even share it with those closest to them. And that's okay if they need to reach out to us when they're ready. It's really about, again, this is how we try to have that empowerment model. It's about making sure that we're giving them choices and options. We're not telling them what to do. Because that would be the first way to do what? Exercise power and control over the person. Well, you should do, and you need to, and
You'll lose
that you are. You really need to give them the opportunity to be able to find it within themselves. An example of that would be, well, if we get a call that says, I'm having nightmares, I can't stop thinking about it. It happened in my apartment. I can't leave the apartment because my landlord won't let me out of the lease. And so every night I'm terrified when I go to sleep and the visions come back. And those are times when, for example, working with a survivor, that you start saying, okay, tell me some of the things that make you feel better. Tell me some of the things that work for you. And so you start to help the individual find their own inner strength to be able, it doesn't make it go away. It doesn't make the pain or the trauma go away, but it helps them start to get to a place where, okay, I can actually start talking about this, I can start facing this, I can start actually thinking about tomorrow, or maybe it's just 10 minutes from now. Maybe I can only make it to the next half an hour or an hour. But those are the ways that they can get that support.
It's wonderful. You also mentioned to me earlier that this program serves deaf survivors.
We do.
Oh, wonderful.
We do. It's a unique initiative, and it's actually a model that's actually sort of being held up as a what's the word I'm looking for? It's an initiative that we started. It was the first of our kind, actually, in Massachusetts, and has become something nationally that people want to copy in other states and in other programs.
Great.
So we're very proud of it, because what we've learned in the process, it's called Deaf Survivors Program.
Okay.
We provide services for the deaf and hard of hearing community, and they can receive services either by a hearing person who is ASL fluent, or another deaf or hard of hearing individual, because we've actually trained deaf and hard of hearing individuals to be counselors, or through interpreter services. What we found, because we've learned a lot in the process, it's been a challenge to be able to understand that the deaf and hard of hearing are a separate culture, and we need to understand and respect the culture. That it has taken us a long time to understand that we need to be able to give them choices as to how they receive those services or access those services. So that program is really starting to grow, and we are reaching more deaf and hard of hearing folks. And that's kind of exciting, because there are so many marginalized populations that experience sexual violence that don't have access to those services. The LGBTQ community, for example, a lot of intimate partner violence that we're seeing, and we can't ignore that. We need to be there for them. Elder abuse, is another area where we need to be there for elders. I mean, the list goes on. We see it in minority communities. So it really is something that, like I said at the beginning, impacts all of us.
Right.
But we need to also, as an organization, be able to meet the needs of the whole community. And our whole community is very diverse.
It is. I mean, I'm just overwhelmed, and I think that our audience should definitely go to your website, which will be should be on the bottom of the screen, because there's so many more services that we won't touch base on here today. Medical advocacy, that's just unbelievable. And I had a question about medical advocacy. So these people, or advocates, will meet a victim of sexual assault at the hospital day, night, 365 days a year.
Yes.
My question is, does the hospital urge what I'm going to call victim right now, because they're in the hospital, victim/survivor. Does the hospital...
What a wonderful question. Thank you for asking that. We service 8 hospitals within Central Mass. We serve all of Central Mass. So within those 8 hospitals, 4 of which are called SANE sites. That means SANE stands for Sexual Assault Nurse Examiner.
Okay.
Not as in I'm sane or insane, but Sexual Assault Nurse Examiner program, which is a fabulous program, and we partner with them. Those hospitals that are actually SANE certified have SANE nurses, and when someone presents in the ER who has been a victim of any kind of sexual assault, a SANE nurse gets called, and we get called at the same time, which is fabulous.
It is.
In the non-SANE sites, hospitals that don't have that program yet, we try to really develop a relationship with the ER staff and administration so that they will actually pick up the phone and call us when somebody presents there who is a victim of sexual violence. Now, sometimes that works well and sometimes that doesn't. It's challenging. The ERs are busy rooms, and the work that they do, is extremely busy. But we have discovered that those that we're developing partnerships with, they actually love us to be able to be there for the survivor, because it gives a whole nother level of support that in a busy ER, the ER nurses can't always provide.
Right.
And so going through that process can be huge. So the answer to your question is yes, most of the time. Sometimes we don't. Sometimes we know about it through the hotline call.
Okay.
Someone who's calling us in crisis, who then we're certainly encouraging. We don't tell them you should, but we're encouraging them to sort of make sure that they're getting medical attention and have they been seen. And if they say, yes, I'm going to go, then we say, we can be there for you. So sometimes it comes through that. But very often it's the hospitals themselves that call us. And now that they know that we're actually able to provide that service, it also is in great support of the work that they're doing in the emergency room. So it really is a win-win for the survivor, the hospital, and for us, because we want to be there for them.
That's wonderful news. Also, I think it's wonderful you accept donations of all kinds, money, a car, household items, books, CDs, DVDs, which I think is wonderful. And I think what's important too, the way to end this is how can someone like myself make a difference in some of these survivors' lives?
Well, first I would just like to say to you and to everyone listening, you already are. If you care about this topic, if you're watching this show, you've invited me on, you already are making a difference. And I don't say that lightly. When any individual cares enough to actually want to have a conversation about this, you're making a difference, because you are essentially have the ability to change someone's mind and change someone's attitude. Talking about it is one of the best ways to actually open it up. We need to end the silence. Our tagline is ending the silence, ending sexual violence. And part of the reason why that tagline is there is because when I talked earlier about it being a silent epidemic, it is the subject that people don't want to talk about. And we have to break the silence. So talk about it. Talk about it often, talk about it a lot. The more we talk about it, the less difficult it is. The less difficult it is to use those words.
Right.
So that's the first thing. The second way, certainly to make a difference, is there are many ways that people come to our organization wanting to help and support it. Some people volunteer their time, the gift of time. You can go through intensive training and become a counselor if that's something you're interested in. It's okay if you don't. There are many other ways that you can volunteer the organization. We have a lot of work around fundraising events, people who are interested in that. We also have work around education, so they can learn about how to help with the education piece. You can, of course, we accept money. Always, we never have enough. We rely obviously a lot on government and state funding to do this work, and so financial donations are huge to help us do this work. We're a small organization that relies on a huge pool of volunteers to do this work. So financial donations are great. Another way we get those financial donations is through car donation program that you talked about. And that was new, that we started last year. An old car that you want to get rid of, that it will actually be removed from your property. You don't have to worry about having it towed or taken anywhere. And whatever the value is that is assessed from a private company, we get a percentage of that to the organization. So it's a great way if you're trying to get rid of an old, and it can be a boat, a car, an RV.
It doesn't have to run either.
And it doesn't have to run. It doesn't have to be in running condition. It really doesn't. So it could be the old clunker that's rusting out as your lawn ornament that could be picked up, and it could actually be given for a good cause. As far as goods, we provide aftercare clothing to survivors in the hospital. Sweatsuits. We always need sweatshirts and sweatpants for individuals leaving the hospital, because as you can imagine, their clothes are often kept for forensics, evidence collection. So we provide that. It's very expensive. So any donation of, non-logo sweatshirts, just plain colors, preferably not red, just as you can imagine, that color can be triggering for some survivors. But plain color sweatsuits are great. Boxes of tissues, believe it or not, are huge because we use them in our counseling rooms all the time. And paper is very expensive. Paper goods are expensive. So those are the critical kinds of goods. We've actually had communities do a drive, like at Christmas time, do like a drive where they've collected boxes of tissues for us, or boxes of sweatpants. So there are ways that as a community, a group could say, I want to do that. I want to get a group of my friends together in the neighborhood and let's just make a collection and donate it to Pathways. So there are many, many different ways that you can support our organization, some of which can be time, some of which can be good, some of which can be money, but most of it is really about caring enough about the subject to supporters come to our events even, you know. And particularly if you have someone disclosing, encourage them, if nothing else, to access our hotline. Very often that's the first and best entry point to accessing services.
And the hotline actually is 24 hours, 800-870-5905, and that should be a banner on across today's show. I want to thank you so much, Kim, for coming today. It was just a pleasure. You're just a wealth of information, and
well, it was a delight for me, Kathleen. And as you can tell, you know, you have to cut me off because I could talk forever about the subject.
I could listen forever.
You've been
as well.
wonderful, and I'm sure, you know, as often is the case, you leave and you think, oh, I wish I had talked about this, and I wish I had talked about that.
Well,
so there's never enough time to really talk about it.
There's not, and that's why, you know, I urge everyone to go to the website so for more information. It's a wonderful website, and you can come to the Board of Health and and come and pick up a, you know, pathway for change brochure if you would like. So again, thank you very much.
Thank you so much. And one last thing I'll say that I didn't mention is another way to get involved is we have a board of directors being a nonprofit, and we're always looking for interested candidates who would like to serve on our board of directors.
Wonderful.
So that's another way that people can get involved. So, but talk about the subject, talk about the issue with your family and friends, and let's break the silence. So, thank you so much.
Thank you.